out there. Very good, very good. Okay, thank you. Well, then let's start, and I will do a very short kickoff. Yeah, now I get the messages. Hello, everybody. So, very welcome to the, I believe it's the 5th launch, Neil, correct me if I'm wrong, of the EPF Contraception Policy Atlas, the 2022 edition. Oh, and it says here on the occasion of Valentine's Day. That's on Monday, but I think it's a very good occasion. And I'm very, very pleased to do it together with Fred Matic. There he is. We are your pilots today, and we're your pilots also of the working group. And we're very pleased to again host this event. It's a pleasure and an honor, and I think it is a topic which is very, very important and also becoming more and more visible on the political radar, if you want. Unfortunately, thanks to some governments in Europe where contraception is not in good hands, but I'm sure that we're going to hear more about that during the presentation. So I think I'll give the floor to Fred before we start the program. So Fred, over to you.
Thank you, Sophie. Hi, everyone. Once again, I'm very glad to be with you today. So thank you for possibility to speak in my mother tongue in Croatian, so I will continue in Croatian. Drage kolegice I kolege, izuzetno mi je drago da vas danas mogu pozdraviti na predstavljanju novog kontracepcijskog atlasa i želim prvenstveno čestitati radnoj skupini koja ga je izradila i kolegici Marini te kolegi Nilu iz IPF-a koji su cijeli proces koordinirali. Ovi pomalo već mogu reći redoviti susreti kada predstavljamo neke nove alate, informacije i baze podataka govore o tome koliko je IPF i cijeli tim posvećen tome da zaista zajedno osiguramo puni pristup seksualnim i reproduktivnim pravima. Osobito me veseli da je danas tema upravo kontracepcija, čime se bavim gotovo od početka svog mandata u Europskom parlamentu. Kontracepcijski atlas predstavlja sveobuhvatnu interaktivnu mapu koja nam na pregledan i brz način daje uvid u podatke o tome kako Europa i svijet stoje u osiguravanju moderne kontracepcije. Nažalost, kad pogledamo atlas, vidimo da s tim informacijama ne možemo biti zadovoljni. Naši stručnjaci će nam dati više uvoda u to za nekoliko minuta, a to ću i sam pozorno pratiti. No, moja glavna poruka danas je svima. Kontracepcija mora biti dostupna svima i oko toga jednostavno nema pregovora. No, kako danas ne bi sve bilo samo u obliku jednostrane prezentacije rezultata atlasa, naši kolege pripremili su jedan kviz čije vođenje će preuzeti Leonidas Galeridis iz IPF-a. Leonidas se pridružio IPF-u kao asistent u zagovaranju koji prati i analizira razvoj politika, publikacija i ključnih intervencija u donošenju odluka na razini Europske unije u području seksualnog i reproduktivnog zdravlja i prava. Također, Leonidas podržava nacionalne i europske zastupnike koji rade na seksualnom i reproduktivnom zdravlju i pravima i moram reći da je i mom uredu bio od velike pomoći i podrške i hvala mu na tome. Leonidas, izvoli, floor is yours.
Thank you very much, Ms. Veld. And I will now just give a minute. So we kindly ask, thank you very much for joining us. We kindly ask all participants to go to this website. Also, the link has been sent in the chat. You can see it's ahaslides.com. I will send it now to everybody. Okay, and you can use, I think soon you will have the link there. You can use either your phone, preferably, so you can simultaneously attend the event on your computer or also your computer. There are several questions in total, and the 3 participants who get the last 3 questions correct and are as well the quickest will get a surprise prize from EPF. So good luck to everybody. So the first question is, what's the first word that comes in your mind when you hear the term contraception? So here you can just type the first word that comes in your mind, and we'll wait some seconds so that everybody can participate. So I think we can proceed to the next stage. So now you will see all the ideas of our participants, and you can upvote the words that you think they are more that you agree with. So we can see, like, you can see also in the screen that choice is like one that's like more popular. And now you can see the results here. You can see the choice, the most popular answer among our participants: empowerment and freedom. So we'll proceed to the second question, which is what could be improved in contraception policies in your country? I will open the submission now, and you have 23 seconds to answer what's, in your opinion, something that could be improved in your country. You can see live the different answers. 5 more seconds. So you can see that cost and education are like the two most popular answers, following by access, availability, and information. We proceed to the third question. Does the national health system in your country cover contraceptive supplies? You have again 20 seconds to answer. That's to test, yes, your knowledge. So we can see that it's always partially, which that's like our goal is to do it fully. And there is also a big percentage of 25% that there is no coverage at all. So the next question is, have you ever used the government's website about contraception? You have again 15 seconds to answer. You will see after we have done research on that, you will see the results. So most participants have not used the government's website, and some have used, but a third-party website. So now we will start the quiz, the pure quiz part. You can log in. You have to type a username, nickname. So we'll wait some seconds. You see the number of players who have joined. We have around 100 people who have joined the event, so we'll wait a little more. So the tricky part is like it's not only enough to answer correctly, but you have also to be quick. So the quickest and the person who will find the 3 answers will get our surprise prize from EPF. So, okay, I think 55 players have joined. We can start the quiz. So, first question, will appear soon. In your opinion, what's the most used form of contraception in Europe? So you have 20 seconds to answer. Either the pill, male condoms, or long-acting reversible contraceptives. So, well, the most common is the pill. That's the correct answer. Although somebody think it's male condoms, but no, the pill is the most common contraceptive. 23 people have guessed the correct answer. So we proceed to the second question of the quiz. Which is the most reliable contraceptive method according to WHO? So the answers are pill, long-acting reversible contraceptives, condom, or calendar method. You have again 10 seconds to answer. So the correct answer is long-acting reversible contraceptive, and most of you have found it. So congratulations, bravo. 40 people found it. And now we proceed to the last question, the third out of 3. How many governments in Europe offer good online information about contraception to their citizens? So the 3 answers are 16 out of 46, because not only Europe, European Union, there are other countries in the continent. 37 out of 46 or 8 out of 46. And that's data based on our research that we'll present soon. So you guessed it, well, it's the right answer is 16 out of 46. Half of people said that, and half of people said 8 out of 46. And now we'll see who are our winner here. So Train, Antonina, and Camille, we have like, oh wait, I see. Yes, exactly. So please send us an email, and we will take care of giving your present. Thank you very much for participating, and I hope you enjoyed the quiz, and I will give back the floor back to our hosts. Thank you.
Hvala Leonidasu i hvala svima koji su sudjelovali u ovom vrlo interesantnom kvizu. Jedan poseban način, vidimo kako je zanimljivo, kako imate uvida u temu kontracepcije u Europi, ali naravno da ima prostora da čujete neke informacije s kojima se do sada niste susretali. Stoga ćemo sada, kako bi dobili više uvoda u Atlas, riječ će preuzeti naš kolega i prijatelj Neil Data, kojeg svi vjerujem dobro znamo, ali dozvolite da samo kažem nekoliko riječi prije nego što njemu dam riječ. Neil je tajnik Europskog parlamentarnog foruma za seksualna i reproduktivna prava od 2004. godine i osnovao je organizaciju s odabranom grupom parlamentaraca i uz potporu IPPF-a 2000. godine. Neil ima više od 15 godina iskustva u području kojem se bavi, a tijekom cijelog tog razdoblja proveo je dubinsko istraživanje aktivnosti protiv prava na izbor u Europi, objavljujući i poznato izvješće iz 2018. koje i nadalje dobiva pozornost svjetskih medija. Uz sve to moram dodati, Neil je bio jedan od ključnih dionika u procesu rada na mojoj rezoluciji o seksualnim reproduktivnim pravima i zdravlju žena i dao je neizmjeran doprinos kao i ostatak njegovog tima. I uz veliku zahvalu za sve to što je napravio i što će još napraviti za sve nas, dajem riječ Neilu. Izvoli Neil, floor is yours.
Thank you very much. Thank you, Fred, and thank you, Sophie, for the great introduction. It's really lovely being here with you and to count on such really important support from MEPs such as yourself for this important issue. And I think, Sophie, this is now an annual gathering for us on the Contraception Atlas. Hopefully next year we'll be able to meet in person. And as you know, on this day, we don't just have the Atlas, we have the contraception themed chocolates as well, which don't work very well in a webinar format, but hopefully next time. But so thank you very much. And thank you, Leonidas, for taking us through that introduction to contraception. So I'll be presenting this year's edition of the Contraception Atlas, and I'd like to thank Marina Davidashvili for really having pulled this together. So first, just a high-level reminder: why do we need a Contraception Atlas? Today in Europe, it's still 35% of pregnancies which are unintended, and it's 56% of women who use some form of contraception. So you can see, even though we're doing quite well globally, there's still a lot of work that needs to be done. Next slide. So what is an atlas? So many of us have been around at the previous launches of the Contraception Atlas, so this won't be new, but there's some new people here. So this atlas is an online tool that scores 46 countries, so the big Europe, including Russia and Iceland and Azerbaijan, on what their governments are doing on making contraception accessible. We take a look at three broad categories: the access to the contraceptive supplies, then the access to contraceptive counseling, and then what is the government doing providing online information as a proxy for all types of information, but we can take a look at online about access to contraception. And just also, some of us sometimes have more of a public health or medical background, and will read the map thinking it's a public health, that it looks at public health issues. This atlas does not look at contraceptive prevalence rates. So the numbers you're going to see are an extrapolation of how governments are doing in terms of policies. Next slide, please. Okay, so the atlas, it aims to provide a living document on what governments are doing in relation to contraception. By doing this, we're hoping that it can spark debate among stakeholders in different countries, so that countries who are scoring in a certain way and they see their neighbors doing differently, they can start asking questions. So it's a rather comprehensive tool. Within those three categories, we have 5 criteria and 16 sub-criteria. And then with this edition in 2022, we've added 2 further indicators. One is on long-acting reversible contraceptives. As Leonidas during the quiz showed us, according to WHO, this is the most effective type of contraception. And then also we took a look at the age of coverage of young people having their contraception covered in their national health systems. So we've added these 2 things for this year's atlas. Next slide. And also just a high-level reminder, why is contraception important? Well, very basically, just to ground us all, increased use of contraception contributes to fewer unintended pregnancies. Fewer unintended pregnancies leads to fewer induced abortions. And Europe has among the highest contraceptive prevalence rates and the lowest abortion rates in the world. But this progress is very uneven, as we'll see. Some countries do very well, some countries do not that very well, not that great. Next slide. And ta-da. So here is this year's Contraception Atlas. So I'll give you a few moments to take a look at this, but a few things that you can see. This year, even more than previous years, there is a clear east-west divide. Okay, so that almost all the countries in Western Europe are doing very well. And then there's a lot of work that needs to be done on the east of the continent. And as we'll be showing later on, this year we have the good news that it's been a race towards the top. So that last year we had 1 champion, that was Belgium. This year we have 3 equal co-champions, with France and the United Kingdom both catching up with Belgium in snagging the top spot. But then very closely behind Belgium, France and the UK, we have Germany, the Netherlands, Luxembourg, and Sweden, and also Estonia. And then you have an outer ring of countries. Unfortunately, the loser this year remains Poland, and it lost even more than it did last year because we were taking a look at more criteria, and the more criteria we looked at, the worse Poland was doing. And then we were able to adjust some findings for some countries as we were more precise. So you can see there, this is what the map of Europe in terms of government policies on contraception looks like for 2022. Now we'll take a look at a bit more in detail. So in terms of key findings, when we take a look at the criteria of contraceptive supplies and counseling, we have good countries all the way to very poor. The good countries have a general coverage for contraceptives, and they include at least one long-acting reversible contraception. A new thing that we added this year is we specifically looked at coverage for young people up to 19 and up to 25 years. And they also have special schemes for low-income or low-income women or other vulnerable groups. We then take a look at the other side of the spectrum in the poor, in the very poor and exceptionally poor. You have no reimbursement for the general population. You have no reimbursement even for vulnerable groups, but there is some sort of counseling. So you can see, and everything falls in between that. Next slide. And then if we take a look at online information, the very good category includes some countries which have government-supported websites, which are easy to find, they're easy to navigate. Very often, a number of them have a tool where women can input what their preferences are, and then the website will generate suggestions as to what is a certain type of contraception for ideal for them. And like this, women are able to make more informed decisions about what would be good for them. On the other hand, in a number of countries, and unfortunately, the countries doing poorly in this area have stayed in that category. The government provides no information, and there's not even private sector actors that come in to fill the gap, such as NGOs or pharmaceuticals. Next slide. Okay, if we take a look at positive changes since 2021, since last year's edition, so these are changes that took place in 2021. One of the main things to point out is in France, young women will have contraceptives reimbursed up until the age of 25. In Iceland, there's new provisions on who can prescribe hormonal contraception. Also some progress in Italy with doing away with unnecessary administrative barriers. Nice progress in Lithuania in making available some form of long-acting reversible for younger women. And in the UK, they reclassified 2 contraceptive pills to make them more accessible. Also, we are aware that Ireland will be moving in the same direction as France, but they're not included in this year because the measure is not yet effective. It will take place at some point this year. So we can see here a nice trend in a positive direction. Next slide. Some major policy changes we also need to mention, so that there's work taking place at the Council of Europe now, which will result in a resolution on sexual reproductive health and rights being drafted by a Dutch member of the upper house, Petra Stienen. And then also we have to mention the landmark report of MEP Fred Matic of June last year, on sexual reproductive health and rights, which provides guidance on what countries should be doing in this area. And then also mention of the situation in Poland by the European Parliament. Next slide. So some of the main findings of this year. So most countries that cover long-acting reversible contraception provide several options, hormonal or copper IUDs and implants. But what we find is that 41% cover contraception to the adult population in their national health system. And then a different set of countries, but also equaling 41%, cover long-acting reversible contraception in their national health system, including for young people. So you can see there's quite a bit of progress to be made. Most countries which cover contraception for young people will do so up until the age of 25. That's 28 countries, but only 4 countries up until the age of 19 or 20. So there's still some room to maneuver, and it's less than a third of countries that do that. And then when it comes to providing online information, and there are some of the best examples are really France, Belgium, the United Kingdom, and a number of other countries. It's still just over a third of countries that provide good websites, including social media, online chat, hotline, what's called the decision aid that I mentioned earlier. So there's a lot of progress to be made. Next slide. So if we take a look at overall findings, so from the map, if we boil it down here, then in the very good category, we have really 9 champion countries. So Belgium, France, UK, but Luxembourg, Sweden, Estonia, Netherlands, Portugal, and Germany. Then you have some good ones as well. Then we get into the medium poor and very poor. As I mentioned, Poland remains in its own category, in its own space. Very poor countries, that should be a cause for concern. Slovakia, Greece, Croatia, Montenegro, Hungary, Belarus, Bosnia, Herzegovina, and Russia. And then we have the poor ones, which have really just stagnated over the past couple of years: Azerbaijan, Armenia, Romania, North Macedonia, Georgia, Czech Republic, and Cyprus. And then you have the in-between countries. Next slide. So maybe some key conclusions. So as I mentioned, France and the UK catch up with Belgium. And so we have a positive story of a race towards the top this year. We have 6 countries that introduced policies improving access to contraception in last year. Governments are increasing the age of contraceptive coverage and are including long-acting reversible contraception. And so overall, the story is that of a positive trend. Those countries who are doing poorly stayed doing poorly. We've seen no progress in Eastern Europe, especially the EU member states of Slovakia, Greece, Croatia, Hungary, and Poland. And the conclusion is that access to modern, effective, affordable contraception still remains a challenge unnecessarily for many women in Europe. So I think I'll end here. Next slide. Before the end, we just wanted to contrast these findings with an emerging discussion that's been appearing in Europe every now and then, that of concern about declining demographic trends. So that there's concern in many countries, specifically Eastern and Central European countries, about shrinking populations. And indeed, the 10 fastest shrinking population, the countries with the 10 fastest shrinking populations are all in Central and Eastern Europe. So you have them listed there. And if we go back one slide, so just take a look at those countries and then remember what I said earlier about the performance of these countries in terms of access to contraception. So the countries experiencing shrinking populations are nearly identical with the countries which score poorly in terms of access to contraception. Next slide. At the same time, there's a new report from UNFPA looking specifically at Central and Eastern Europe, which shows that there is no correlation between the use of modern family planning and low fertility. It's a false analogy that's often being used. So, and in fact, what we see is that access to contraception improves women and their families' ability to proactively plan when they will have a family, so that the countries who have the best policies in access to contraception also tend to do better in facilitating their citizens and the women in their countries having their desired number of children. Not so the case in countries with shrinking population. So we just wanted to end with that. And I think now my presentation is really over. And really just to thank the expert group that worked very well with us over the past year, the national partners and experts who validated all of the data and will be working with them in order to bring this to national level, and also to our benefactors, Organon, a new company in women's health who's been doing great in listening to women and supporting us with this initiative. So thank you very much.
Thank you very much, Neil. This is, I'm going to read it with great interest, as always. It's providing, I mean, even your very dense, condensed presentation is providing us with a lot of information and insights. I mean, just a few random thoughts is, first of all, you know, you'd wonder why the European Commission is actually not doing this when they're making this similar maps about, for example, COVID and vaccination. And I also see certain similarities there between this map and the vaccination map of Europe. It's quite shocking to see that there are 8 member states. Just hang on with the video information animation. Just 1 second. 8 EU member states which are scoring poor to extremely poor. I mean, 8. That's almost 1 in 3. And indeed, you point out that there is a clear correlation between member states where that provide good access to contraceptives and where population is not in decline or not at the same rate. And I would almost say there seems to be a correlation between a low trust society and low fertility. So it has everything to do with the quality of governance. Okay, so now we're going to watch an animation, and after the animation, I am going to give the floor to my friend and colleague Irène Tolleret, the MEP from France, who is going to France, one of the top scorers, to explain the situation in France, and then we will listen to Professor Emeritus Mr. Johannes Bitzer, who is the delegate of the European Board and College of Obstetrics and Gynecology. And he will speak to us about what can professional societies do to improve sexual and reproductive healthcare. So first we're going to watch the animation. Okay, Irène, are you out there? You have the floor.
Thank you very much. I have a little file problem, but it will be 2 seconds. Hop. Here we are. Up. Yes. Is it okay with the video translation, everything? So hello, everybody. And I'm very glad to be here today for the launch of the 5th edition of the Contraception Atlas. I would like to thank the co-chair of the MEP for Sexual and Reproductive Rights, Sophie, in Veld and Fred Matic for hosting this webinar in cooperation with EPF. The Atlas is a very important indicator of the extent to which governments prioritize people having a choice over their reproductive life. Scoring 46 countries all over Europe, setting indicators and creating benchmarks is crucial to trigger legislative changes in European countries as well at the EU level. Thanks also to the Atlas, every year, member states are pushed to improve their legislation on access to modern contraception. And I'm glad to learn that several member states are developing plans to launch their own national atlases, highlighting regional discrepancies to tackle domestic access issues. Today, we have to fill important gaps across Europe, such as high cost of contraception, insufficient availability, information gaps, and discriminatory policies. Modern contraception in many countries is still totally or partially excluded from public health insurance plans. Many member states do not reimburse a contraceptive method when its use is to prevent unplanned pregnancy. Others cover contraceptive costs for adolescent girls or young women, but not for older women. Finally, some countries cover only a few specific contraceptive methods, and in one member state, Poland, emergency contraception is no longer available without prescription. The European Parliament is doing its best to fill these gaps. The most important and recent step we have made is the adoption of the own initiative report on sexual rights and health rights, reproductive and health rights. Thanks to the courage and to the dedication of the rapporteur Fred Matic, the European Parliament has adopted an ambitious and comprehensive report calling for the protection of the right of each individual to make their own choices, the right to physical integrity and personal autonomy. Sexual and reproductive rights have been addressed as an essential component of public health from their multiple angles. Access to legal abortion, access to comprehensive and age-appropriate sex education, access to contraception, access to fertility treatments, access to maternity-related care, and access to safe, fair, and circular menstrual products. Guaranteeing access to these rights means guaranteeing the fundamental right to health, achieving gender equality, and eliminating gender-based violence. This strong and timely call from the European Parliament needs now a prompt reply from the Council and the member states. It's high time for a paradigm shift that puts gender equality and SRHR at the core of the European agenda. The French presidency of the European Union, through its programme and priorities, and especially through the speech delivered by President Macron on the 19th of January in Strasbourg, gave a strong signal to all of us, outlining two proposals that I would like to mention today. First, the inclusion of abortion in the Charter of Fundamental Rights. 20 years after the proclamation of the Charter of Fundamental Rights, which has enshrined the abolition of the death penalty throughout the Union, the French presidency is proposing to update this charter and be more explicit on the recognition of the right to abortion. The Charter of Fundamental Rights has the same legal force as treaties. It is therefore binding on the member states when they are implementing EU laws. The inclusion of abortion in the Charter would have a tremendous impact. The most important policies of the European Union mention the respect of the principles of the Charter among the enabling conditions for member states to receive EU funds. This means that ideally, member states denying the right to abortion to their citizens could be sanctioned and not receive EU fundings. Of course, it is not simple to update the Charter. It has been adopted by the presidents of the European Commission, European Council, and European Parliament, and a modification will have no legal force unless the EU treaties are revised. However, it is worthy of discussion. We need to continue pushing this proposal and make our best to endorse it, at least from the Parliament and Commission side, to put pressure on governments. Second proposition, the signature and implementation of the Simone-Veil Pact. The French presidency will also strongly support the Simone-Veil Pact, a declaration aiming to preserve, promote, and strengthen the rights of all women at all levels, European, national, and local, in all areas, public and private, for all generations in all member states of the European Union. This is a pact between signatories to promote an upward alignment of women's rights in Europe at their level of responsibility. The first priority of this pact focuses on sexual and reproductive rights in order to guarantee women's access to contraception and abortion, as well as to information and education. I am very proud that my political group promoted this pact since the beginning of the mandate and now has decided to take advantage of mid-term EP international negotiations to launch this document and invite all the EU institutions to sign it. President Metsola, von der Leyen and Michel showed their support, and we continue pushing for the official commitment and signature on the pact. To make these fundamental rights a reality for women on our continent, the signatories of the pact commit to identify best practices and the most effective legislation for women in Europe and apply them in their own legislation or propose it at European level as appropriate. I believe that these two proposals show the importance of sexual and reproductive health and rights in the context of the French presidency, and the commitment to achieve concrete results that could have an impact on our life. SRHR play a key role in achieving gender equality. It is crucial to ensure universal access to these rights and address all barriers impeding it. The safeguard of the fundamental rights to health and the right to choice for all individuals need to be a European and common fight. We cannot wait one more minute. Thank you very much.
Thank you, Irene. That was excellent, excellent. And I very much agree with you, in particular on the statement of Macron on the right to abortion, or rather the right to choice. I mean, the right for women to actually take their own decisions. For me, that was maybe even bigger than the Sorbonne speech, because it says something about his views on society. And I think what was good about it is that, you know, for once somebody was outspoken about these values and not timid and not hiding behind the argument that, oh, it's all, you know, national competence. Because if we look at the map, okay, today it's about contraceptives, but we know that it's a package: sexual and reproductive health and rights, the views on women's rights, gender equality, autonomy, and the right to choice. So for me, that was a very important one. Then now I'm going to give the floor to Professor Bitzer, and I should also mention that not only is he on the European Board of Obstetrics and Gynecology, but he also contributed as an expert to the Atlas. Professor Bitzer, you have the floor.
This type of contribution and also collaboration. I will try to, can you give me the floor for presenting? Thank you very much. Thank you very much. I think the question of collaboration is essential in the field of sexual and reproductive health, because it is a huge endeavor of public health also. And this is why we are thinking, I'm sorry, I cannot move the slides. Yeah. We have been working on this issue in the European Board of Obstetrics and Gynecology, but also in the European Society of Contraception, based on the recognition that good sexual and reproductive health care is essential for the health of all women in a society. And there is a large variety, as you have heard, regarding SRH care across Europe. We have different professional backgrounds with different qualifications. We need education and training programs, including continuous monitoring and education. We need assessment of quality and monitoring of professional competence. And we need recognition of the importance of work by health authorities. So all these issues are in the focus of the two societies in their research, but also in their educational activities. Next slide, please. Now, the question is, how can the Contraceptive Atlas and these two professional societies across Europe collaborate? I think, or we think actually, that there are four dimensions. One dimension is to define the standards of care. How should care look like in sexual and reproductive health? That we could contribute making or performing a survey on inequalities in SRH care across Europe. But most of all, I think that we would develop an education and training of healthcare professionals involved in SRH care in a sense of a curriculum on several levels, and that we would also establish exams and quality assurance for different healthcare professionals involved in this care. Next slide, please. So, Chapter 1, Standards of Care. Epilogue has developed standards of care across obstetrics and gynecology, and these standards of care are subdivided in different subtitles: patient focus, accessibility, environment, process, staffing and competence, and training. And we have established this also in a chapter on contraception and sexual health. Next. The next contribution is a questionnaire, which is right now used, and the data are collected about inequalities in SRH care across Europe. As you can see, there is a contraceptive service provision in the center, but there are also other questions about termination of pregnancy, about STI prevention and care, about preconceptional care, about sexual health care. And we asked the members of the societies to give us information about guidelines, access, quality, professionals involved, education program, online services, methods available, and payment, for example, in the field of contraception. Next. And then the issue of education and training. One of the problems is that there is no unified program for education and training in sexual and reproductive health care. It is somehow distributed between obstetrics and gynecology, general medicine, in the fields of nurses and midwives training. So we believe that it is important in the future, especially because at the university hospitals, this field is increasingly neglected to come back with a defined curriculum. As you can see, there is also a focus on contraception, but also on the other fields. Next. Next slide. How is this curriculum going to be built up? It's a competence-based. What should the professional know? What should the professional be able to perform? Which problems in the field of SRH care should the professional be able to resolve? Which are the attitudes and ethical principles a professional SRH care should have? And you can see the program is built up along these lines, that you have modules, learning objectives, knowledge, skills, learning resources, and assessment tools. Next slide. This is just an example for the contraception, where you can see what the different modules are, what the learning objectives are, what the knowledge is, the skills and attitudes, and where the participants can get the educational information. Next slide. Here it is, based on the two pillars of knowledge and skills. I don't want to go too much into detail, but you can see it is very important that we also look in contraception for women with special needs, that we have a life course approach, and that we really look also in the different clinical conditions. The skills are very important regarding the patient-centered counseling and the shared decision-making, and that there is a safe training for insertion and removal of the LARCs and case discussions. Next slide. So in the end, all this educational material which I presented to you, which is provided by the European Society of Contraception and also by Epilogue authors, based on that, we will develop exams and quality assurance on the level of a diploma for healthcare professionals work in the field of SRH, like physicians, OBGYNs, nurses, midwives, but also a fellowship exam for those who are going to specialize in these services, and will have tasks of governments, especially in established health policies, which we are also fighting for, I think, together with the European Parliament. Thank you very much for your attention.
Thank you very much, Professor Bitzer. Okay, then we are now going to go to the questions and answers with the audience, and I will have to ask you to post your questions in the chat. I hope that everybody can find it. Maybe until we have questions in the chat, I can benefit from the occasion and ask questions myself, and maybe Irene would also like to come in and ask questions. But I was just wondering, Professor Bitzer, so if I understand correctly, you are developing, I said it wrong. I get a message here. It shouldn't be in the chat, but in the Q&A box. Okay, another chat, Q&A box. And I hope that somebody will get them to me then. Yes, some are coming in already. Okay, I'll still ask my question first to Professor Bitzer, because you are developing this whole package which will be used for training and for standardization, harmonization. And on your board, I suppose all the member states, at least all the member states of the European Union, are represented. Do you feel that the fact that there's let's say a different political climate, or maybe a different public opinion, does that influence the positions, the input of your colleagues from those countries?
That's a very good question. And if I may take the example of Poland, I think there is a very good collaboration in that field. I think the basic values are really among the professional societies across Europe very similar. I don't think that there is much difference. So, of course, we have to acknowledge political realities, but as far as the professionals involved in this field are concerned, I think there is a rather large consensus of what should be achieved regarding sexual and reproductive health care.
Okay, that's well, that's reassuring in a way. Okay, we already have a whole series of questions. I'll take 2 or 3. There is one question to Neil from Andorra. I see somebody's already typing an answer, but I'll read it out anyway. In Andorra, we have a high migration, especially in winter, of women who come to work without access to public health or free contraception. We are a border country with a lack of laws. Why is there no talk of Andorra in those sections? That's a question for Neil. Then another question, maybe to Neil and Professor Bitzer. Was any research done on male contraception? And then another one, anonymous. What can we conclude with regards to low fertility in Eastern Europe and low access to contraception? Does that mean there are more unsafe abortion, less sex overall? Well, I hope not. Or secret safe abortion by private providers. What is the explanation for this? So maybe I'll first give the floor to Neil and then to Professor Bitzer.
Yeah. Thank you very much, Sophie. So in relation to the first question on Andorra, putting aside Andorra, the question of access to health services and contraception for migrants is a very interesting one. And I was just chatting with my colleague Marina in trying to prepare for the answer for this. And we realized that this is an issue we haven't looked at in the Contraception Atlas. And if we take a look from Andorra and extrapolate to the whole European Union or to the whole European region, we find that it's not just Andorra that has a large or an important segment of population, which is seasonal migrants coming into the country and then going back home, and their status, whether they're covered under the national health system or not, and during that period, whether they have access to contraception. At this stage, it's unknown in Andorra or any other country. So I think it's a very interesting question to pose, and one that we'll be exploring for next year. Then, in relation to the question about low fertility in Eastern Europe, I think I alluded to that a little bit in the presentation. When we take a look at low fertility and especially shrinking populations and demographic trends, I think there we have to take a look at that question at two levels. One is, how is this issue being used or being addressed by some politicians? What we see now is that the focus of attention on declining demography, shrinking populations, has been used mainly by politicians who see this as a very useful way to justify restricting human rights, specifically for women and LGBT people, by saying, because we have a declining population, we don't want to encourage contraception. All the abortions could have resulted in live births, and so we need to restrict contraception and abortions. And then also, we don't want to promote LGBT because that will never result in more children. So we see that that's the narrative way in which the shrinking population, low demography argument has been used so far. And people with a human rights base have not really been looking at this. Whereas what we're trying to show here is that restricting access to contraception will not result in higher fertility rates and higher population growth rates. So I think already those very ultra-conservative solutions are they're just false solutions. Separately, at another level, there is the very genuine concern of declining populations. Putting aside the question of migration, if you're a decision maker in a country of 10 million, and within the foreseeable future, within the next 20 years, you know that your country will, from 10 million, will be 8 million, as a policy maker, you need to make decisions. How will you fund your social security system? Which investments do you prioritize? Preschools or nursing homes for the elderly? How do you gear up your health system to deal with an aging population? So there's very real concerns there. It's a legitimate question. And there, I think the answers to this are to be found in a range of different, very complex, interrelated policy solutions. They relate to providing stable employment for younger people. As Sophie mentioned, the trust in government is one big issue. The Hungarian government has made a big deal of having pro-family, pro-natalist policies, but they haven't factored into account the fact that whatever new Hungarians are born now, in 20 years, it will be those same Hungarians which are immigrants to the Netherlands, to Brussels, to France, if the same other policies remain in place. So I think addressing the actual declining population issue is a whole separate thing that involves a whole set of very complex interrelated policy matters. But I think we need to differentiate the real policy issues from the false solutions that are being offered by ultra-conservatives.
Yeah, I fully agree with you. I think that the number of children, fertility is mainly determined by the socioeconomic environment of a society, and people find different ways of somehow limiting the number of children, but the motivation is mainly determined by as you are mentioning, the condition, the life condition, and the prospect for the families with children. This could be seen in Germany now, that the number of children are increasing, fertility rates is increasing. The other issue, the other question which was mentioned was about male contraception. Indeed, there is, now we have been active in this field, creating a consortium on male contraception where the different scientists work together in collaboration with the NIH, where they have picked up the work which has already been done before, especially by colleagues from France also. So I think there are now efforts going on to take up again what has been already developed, namely the combination of a long-acting progestogen and a testosterone replacement combination. So I think this, may come back.
Okay, thank you very much. In the meantime, some more questions have come in. Somebody is asking you to comment on why Poland's score is even lower than last year. Is it the result of including the LARCs in the new methodology? And then somebody asking if it's possible to get more information about the proposal of the French presidency of the European Union. And then the last one is more a remark, saying that one additional explanation for the low score of contraception in Romania, for instance, is that there is little to no access to contraception through the public sector. Fewer abortions or on demand are offered in the public sector, which leads to unsafe abortions, including in the private sector. And also many women of reproductive age are labor immigrants, and maybe they should be counted in the receiving countries such as Italy and Spain. Maybe just one remark, because I would like to reiterate what Neil said, is that the map, the atlas, is actually not an indicator of the uptake of contraceptives. It is an indicator of the policies. Am I right, Neil?
Yep. Yeah.
Yep. Okay, maybe you can also comment on these two, and then I go to Professor Bitzer and then to Irene Toleret.
Yeah, thank you very much, and thank you for the questions. In relation to Poland, the answer is very easy. Because we expanded what we were taking a look at, we took a look even more in detail at the different indicators, and when we take a look even further in more depth in Poland, we find out that it does even worse than what we thought. So that's why the score is even lower this year than it was last year, not because Poland did any worse, but because we were looking at more things and we find out that Poland is even worse than what we anticipated. So that's the easy answer for Poland. When it comes to Romania, that it's more of a comment, and I just want to point out how tragic the situation of Romania is, where if some of us will remember back before 1989, when Romania was headed by Ceausescu under the Soviet times, under the communist times, and during that time, abortion and contraception were both illegal. And so one of the first things that happened in Romania after the revolution was to legalize access to contraception and abortion. And if you remember at that time also, there was a very high rate of maternal mortality as a result of unsafe abortions. There were also many unintended pregnancies. And some of us who remembered that time will remember those images of orphanages, sometimes filled with children who were HIV positive. That was Romania of 1989, 1990. And they made the necessary policy changes. And then the international community came in, USAID, UNFPA, other bilateral donors, and then set up a very big family planning program. Okay, and what we saw within a few years, within less than a decade in Romania, was a fairy tale story of how things can work well, where contraceptive prevalence went way up, maternal deaths as a result of safe abortion went way, way down, And then also fertility levels then at first dropped and then stabilized, so that then there was a fairly stable fertility level in Romania. So you had the perfect example of how access to contraception, legal abortion, can improve drastically health outcomes and lead to Romanians having the desired number of children that they want that's suitable for their family. And since entry into the EU, the international community has left. USAID is no longer there. UNFPA left. It's an EU member state now. You don't have international donors there. And then slowly, that program was left to rot, so that now there's not much left of it. And that's why you have the very bad situation you do in Romania, whereas it was not like this 15 years ago. So I think Romania is a really tragic story.
Yeah. Thanks very much for that. Professor Bitzer? Is the professor still with us?
Sorry, I fully agree with Neil on this point, and I also remember these changes in Romania, which were so promising. And the question is how to resolve this now. Is this something that could be resolved on the level of the European Parliament, or that's more or less a question to the politicians? Is there any possibility of sort of replacing those former international donors?
Well, that's difficult, but let's say that healthcare is a national competence and very jealously guarded by the national authorities. I mean, we've also seen that with COVID, where they thought that, you know, having national competence was more important than harmonizing at European level and avoiding this whole patchwork. And I think the second problem is that they, at national level, anything to do with sexual and reproductive health and rights is firmly part of public health care. But then suddenly, when you talk about the same topics at European level, suddenly it has become an ideological issue. It's no longer healthcare. That's magic, really. So those are two very big obstacles in this debate. But I think the European Parliament has always been pushing for better policies, more progressive policies, if you want to call it that way. I would say more common sense. Actually, financing those things in EU member states is difficult against the will of the national governments, but we have been pushing for a long time for the inclusion of this whole area into the general public health strategy. And I think there's momentum right now, because after COVID, or well, we're not after COVID yet, but soon, we hope, I think most people are more convinced of the need of a health union. And I think this is also the moment to push for the inclusion of sexual and reproductive health and rights. And I do count, and I'm looking at Irene aussi as well, I do count on the French presidency to very firmly inscribe this in the initial blueprint of such a health union, and not leave, let's say, ideological forces determine at European level that women and men, by the way, should have lesser services. And I think this also the notion that there should be more equality in healthcare, because if you look at this map, it's the map of inequality. Yeah. It's the map of unequal treatment, unequal opportunities, unequal chances when it comes to health. And that is also something that we need to address. So can we intervene directly? No. But can we push? Can we put it on the agenda? Yes. And that's why I think that the importance of the statement of Macron in Strasbourg, it wasn't only about abortion. It was showing that government leaders have a responsibility for these matters at European level as well. And that is part of a whole a view on society, on equality, on health. And that's why I think it was a very, very important moment. Okay, Irene, you have the floor.
Thank you very much. I would like to abound on what Sophie just said, and to start with a strange comment is that what is happening in Poland could happen anywhere else, because as Neil has said, basically these things happen because of politicians that are populist and that decide to keep the power by tackling LGBTQI members, but also tackling women's rights and especially sexual and reproductive rights. And in reality, when a woman works, if she doesn't have access to childcare, if she has a big gap in the salary, then naturally she will make less children. And this is not, this can be changed by a health, a care policy at the member state level. But instead of doing that, it's so more easy to say, let's cut the right to abortion, make contraception very difficult to have, and the women, they stay at home, they don't work, and the men, they do the job that the women were not doing. This is really the completely medieval sort of speeches that with Fred Matic, when we were working on his report, we had some members of the European Parliament that were vocal on these sort of issues, and that talking about contraception or talking about abortion was promoting them. So it's very important to have leaders like President Macron that take the floor to, first of all, say that these rights needs to be enshrined, and what happens in Poland can happen in France. We have a candidate at the French presidency who considered that these problems about sexual and reproductive rights are not important at all and should not be a focus of any policy. And this is and he is supported by a billionaire who put on the TV the show that on the fake abortion, like Ordoloris sort of film that shows a woman says that abortion and contraception is very bad. So it's very important to have very precise things, and the French government had done some very good things. The first thing, it's one I like a lot. It was that now condoms can be reimbursed by healthcare. If you are part of a fragile or not, you go to the doctor, he gives you the paper, and you can go, and it's only one type of condoms, but still free condoms. You can get them also, of course, in NGO places, but the government has done that. There was also a very big thing that was showed by Neil. It's the contraception, free contraception for all women less than 26 years, because there are a lot of inequalities, and contraception can be expensive. The pill of tomorrow, I don't know how to say that in English, is given in schools by specific school doctors. And so if a girl has done, and she can go and see this nurse in her school, and it's a real doctor, it's a real healthcare prescription, but at the same time, it's inside the school, so it's very effective. And of course, you have a school education. I don't know if the question was on that or on the French presidency propositions, but once again, I think that the symbol of abortion and, as you said, all the sexual and reproductive rights enshrined in the fundamental rights is not only a political image, it's a need, because we need to really protect these rights, because today they are already challenged. And so we really need to make sure that no populist inside our union that gets to the power uses that to keep the power. So let's enshrine them, even though it will be very, very hard.
Yes, thanks, Irene. You mentioned the morning after pill. It's called, being available in schools. And given that this atlas also has a little bit of a competition element in it, there's a kind of ranking. So now France is sort of on top, and of course, being Dutch, I feel triggered now. And we have a new government in place, which is introducing progressive policy. So I hope that by next year we'll be on top. But I think this is a good competition. Mm-hmm. I saw an interesting remark in the Q&A saying that so Romania. This is by Daniela Dragici. I hope I pronounced this correctly. Who informs us that Romania does receive 10 million euros to refurbish family planning clinics through the European Resilience Fund, but actual contraceptives and stuff like that is not included in this sort of funding. So that's what I said. It's always kept out a little bit as if it's an invisible policy, as if it doesn't exist. Okay. I see no additional remarks or questions in the Q&A box. So
may I ask a question? Sorry.
Yes, even two. Take your time.
Yeah. Because when we look at sexual and reproductive health more from a research point of view as a public health issue, it seems that one of the most important factors is really sexual education. And in the Atlas, as far as I understand, this is not part of sort of the evaluation of the country's contribution, of the political contribution. What are your thoughts about this issue of level of sexual education, established sexual education in the schools, etc., where I think there are big inequalities.
There are definitely big inequalities, but maybe this is a question more for Neil actually to answer, whether or not to include it. I think you're absolutely right. It makes total sense because everything starts there, from education and awareness. I see that an additional question has come in. We'll take that as the last question then, by Mary Short, coming from a historically conservative society regarding contraception and abortion. It was via a citizens' assembly that change occurred, and change occurred dramatically with first with same-sex marriage and then with abortion freely available and free of charge in the community. I believe you're referring to Ireland, and indeed that was actually it's an example I often use that demonstrates very clearly that very often politicians who are propagating these very reactionary conservative views, they are usually out of touch with their population, because their population is not at all as conservative. They're just concerned with other topics. But what I'll do, I'll give the floor to Neil to answer some of the questions and make some final remarks. And then if Professor Bitzer and Irene Tolleret want to come back for concluding remarks, that's okay, before I then hand over to Fred to wrap up. Neil.
Thank you. Thank you very much, Sophie. So in relation to sexuality education, in an ideal world, we would include that in the Contraception Atlas, because I mean, the two of them are almost two separate sides of the same coin. You don't know about contraception or how to use it or etc. unless you go through some form of sexuality education. So ideally, we would include it. At a practical level, with the Atlas, we can only assess what can be measured, what can be researched. And the complexity of comprehensive sexuality education makes it so that it's just really almost impossible to take a look at.
That's right.
Because then we're taking a look at education systems. In many countries, these are decentralized almost to local level. And we would find very little unless it was a major project. So for practical reasons, we weren't able to look at this. However, there's been some interesting work that's very useful, that's been done, which takes a look at comprehensive sexuality education in some member states. And so I want to point out the work of IPPF Europe in this regard. They did a barometer on this issue a couple of years ago. And then this issue then featured into a Council of Europe report authored by Petra Bayer, which looked at access to contraception and sexuality education together. So there is some information, but it's not as comprehensive as this. So I think on that, maybe just to also one more comment on Romania, and Daniela Draghici has mentioned that there's 10 million euros available for refurbishing these family planning clinics. I think really this throws us back to what you were saying, Sophie. Now we're at the stage where international donors or international actors cannot intervene in what takes place in an EU member state. And there's reasons for that. And that it's a separate forum to discuss whether they're good or bad, but that's the reality we live in. But what this means is that Romanian decision makers have the ability within reach to take action on this. They have 10 million euros that we know of just from this chat. There's more EU funding going into the country than 10 million euros. Romania is not the poor country of 1989, 1990. It has the resources that are needed in order to do this. What's needed is the political will. And so perhaps one thing that can be done is we're trying to do this, we're trying to raise this issue in the Romanian parliament, but it would be interesting to see about Romanian Renew and SND colleagues, whether they are as proactive on these issues as they should be. And I think that's perhaps one area to take a look at, that is within our immediate range of control. And maybe just to conclude, just to thank you very much, Sophie, Fred, Irene, for really your leadership on this. And I just want to echo what has been said by Irene and Sophie about the importance of what President Macron has said. I mean, really, it's been one of the most important moments in human rights in the European Union in recent years. And I think we really need to see how it is that we could follow up on this. On our side, we are doing an event with the French Parliament in the French National Assembly on the 28th of February, with the delegation, with the involvement of MPs from the Delegation on Women's Rights, which will explore this issue along with civil society from the Planning Familial, which will explore this issue. And Minister Clément Beaune has already agreed to speak at this meeting. And so we're hoping to be able to have a discussion with them. Now that President Macron has said this, you will be in a room full of allies for women's rights and human rights. What can we all do to help you reach this goal of putting the right to abortion in the EU Fundamental Charter? So end on this, and thank you very much for your attention and really your leadership on this issue. Thank you.
Well, thank you, Neil. I think the praise is all for you because without the really very, very precious work that you have been doing so diligently and so continuously for so many years. I mean, that's really literally priceless. If I don't know if Professor Bitzer and Irene Tolleré, you want to make some very, very short concluding remarks before we go to Fred Matic. Professor Bitzer?
For me, it was very interesting, and that's my closing remark. And thanks for this excellent work, and I hope for future collaborations.
Thank you very much.
Yes, thank you.
Irene,
Same thing. Yeah. Thank you very much. And I forgot to say that the French government has done a specific website where you can choose your contraception, and it's very serious. And one of the problems that we have in general is that the lobbies that are against women's rights in general, they also do fake websites. But a government website that gives a simple access to the different types of contraception, I think is a good move. If I manage to put the link, you will see it's very well done.
Thanks. Maybe the host can collect all the comments and the links that have been posted in the. Oh, Irene seems to be gone. Am I still in the session? Okay.
Yes. Yes.
Oh, I am. Yes. Oh, there's Irene
Moving
again.
in
Hi.
my phone.
That's it. Okay, then I'm going to ask Fred to make the closing remarks, but I would not before saying a big thank you to Fred as well for showing a really strong leadership. And let's face it, for somebody who's not a woman from one of the, let's say, green countries on the map, I think it is really extra special the way that you are showing leadership, the way that you have sailed your report through Parliament. That is really unprecedented, very important, cannot be underestimated. So a big thank you from me. And please, you have the floor for the wrap up of the session.
Još jedanput puno ti hvala, Sofija, puno ti hvala na vođenju današnjeg webinara. Želim zahvaliti svim našim kolegicama i stručnjacima, našoj dragoj kolegici Ireni i uvaženom profesoru Bicaru. I nastavno na sve što smo danas čuli, ja ću još jednom iskoristiti priliku da zahvalim autorima ovog atlasa i naglasim da su ovakve mape i podaci ključni u našem političkom radu. Oni nam omogućavaju jasan pregled podataka na jednom mjestu, a ujedno sažimaju i neke od ključnih argumenata u našim političkim borbama. Slušajući izlaganja i analizirajući atlas, moram vam reći da me jedna stvar najviše šokirala, a to je nažalost ova velika razlika između istoka i zapada. Nevjerojatno je da i dalje ne postoji minimum standarda u seksualnom i reproduktivnom zdravlju i da, na primjer, jedna Poljakinja ima neopisivo lošiji položaj od jedne Francuskinje, a svi zajedno smo u istoj uniji. Ovakvi podaci nam vrlo jasno ocrtavaju koliko je velika potreba za ujednačavanjem pristupa u ovom području. Žalosti me i činjenica, naravno, da životi i zdravlje ovise o tome gdje ste se rodili, odnosno gdje ste migrirali. Puno puta danas je istaknuta važnost moderne kontracepcije i nema potrebe da to ponovo ističem. No ono što ću dodati je da države članice moraju shvatiti da to nije nikakva privatna stvar koju se može ili smije stigmatizirati ili umanjivati njen značaj. To je pitanje javno-zdravstvene politike koja sačinjava veliki dio osobnog prava na zdravlje i ona je odgovornost svih nas. Kontracepcija se mora osigurati svima, bez odgode, bez stigme, bez diskriminatorskih praksi, rodnih stereotipa i bilo čega drugog. To je ono na čemu nastavljamo raditi. Ja znam da ćemo svi zajedno na tome raditi. So once again, thanks all of you for your participation and contribution on today's very important webinar. Hope to see you soon and have a nice rest of the day.